Hello, this is Amanda Brummett with the Working Well and Coppell Committee of the Coppell Chamber of Commerce. Today, I'm here with Dr. Amy Balis. She's a board-certified radiologist that is fellowship trained in breast imaging. She's the medical director for the Baylor Scott and White Medical Center Irving Women's Imaging Center. Thanks for being here, Dr. Balis.
Thanks so much for having me.
Yeah, absolutely. So I want to start with, what do you do to set up your entire team for overall physical and mental health, especially with the crazy year we've had?
So, employee wellness overall is very critical in the field of medicine because what we do on a daily basis is so very stressful in itself. Particularly in my office, we're finding breast cancer and often telling women that they have breast cancer. And that can be very stressful on both the radiologist, the technologist, the administrative people, on everyone that's working in the office. And we really need to find ways to relieve our own stress so that we can be on top of things for the patient and be able to be a calming force for them. So the wellness at home and at work is so critically intertwined. And it's been so stressful this past year with all of the problems that we've been going through with the pandemic. It's been even more stressful. So it's even more important that I know that my staff is able to focus when they're at work and not have to worry as much about what's going on at home. So it's very important that we allow our staff to take mental health days, personal days, do things for themselves. We really need to work together and cooperate when we feel like someone has something going on that may affect their work. We're in a position where mistakes are really intolerable. Like, we can't make mistakes. I mean, everybody's human, but we really have to limit. And so anything that can distract us really needs to be taken care of. So it's really important that we do things to help focus. And one of the most important things we do is make sure that everyone's getting enough sleep at home. Even when that's hard, we know we have so many responsibilities, especially as women. And my office in particularly is filled with women who have been kind of, unduly burdened with the pandemic because of things with childcare at home and a lot of issues with staying home. And so we try to make it a priority to make sure everyone has what they need to have enough time to take care of what they need to at home and at work, even if that means reducing their hours at work so that they can get stuff done. We'd rather do that than have them be stressed out and overworked and feeling, tired and getting sick themselves. So trying to just, respect each other's needs at work and communicate and have compassion with each other, not just with our patients. We really have to work as a team and figure out our needs. We use, we try to do some incentives and rewards that will help everybody keep track of what they need to do to stay focused and do the best things we can for our patients. And I try to lead by example. Like I said, the most important thing you can do is listen to each other, make sure you're taking care of yourself. And that way you can do the best thing for yourself at work and at home.
Yeah, that makes a lot of sense. Wow. Well, so let me ask you this. While you're overseeing a team of people, taking care of them, you are clearly taking care of patients and dealing with, some really deep topics and heavy topics every day. And you're a mom and you're a physician and you've got all this stuff going on. How in the world do you make wellness a priority for you in your own personal life?
So for myself, there are a couple of major things. One is I just like the things everybody should be doing. I try to eat healthfully and mindfully. I try not to multitask when I'm having meals. I try to kind of make it a focused time where I can just kind of concentrate on and make good choices about what I'm eating. I think if you feel good about what you're eating, that's helpful. I personally exercise as much as I can, even with my busy schedule. I get up really early in the morning so I can get it done in the morning. I do some local triathlons, so I swim and bike and run. It's hard to fit all of that in, but I
Wow.
try to do that in the morning or in the evening. I find that it really helps me to just de-stress my day, to get some exercise, even if you just go for a meaningful walk. But so I do a lot of walking with friends. I find that talking with friends, especially during this pandemic, if you can find somebody that, you can kind of be in a little bubble with, it's really helpful to have somebody that you can share all your feelings with. I do quite a bit of reading. I don't watch a lot of TV, and I'm not on a lot of social media. So I think that's helpful. I know it's not realistic for a lot of people. So, whatever works for them is best for them. But for me, I really, reading, exercising, eating right, those are the things that kind of keep me grounded and stress-free. And those are my happy place.
Yeah. Oh, those are so awesome. I love all of those. So I know as a physician, your wish list for what we knew and would actually do is probably incredibly long. But today, if you could only pick one thing that everybody knew about their health and that they would actually follow through with, that one piece of advice they would listen to, what would it be?
I mean, the most important thing is to listen to your body. I think especially as women, we ignore a lot of things because we're the caretakers. And so we want to sometimes ignore what's going on with our own bodies and take care of everybody else around us. But you're not going to be any good to take care of other people, your family, if you're not taking care of yourself. So we see a lot of women that delay their own medical issues because they're too busy taking care of everybody else. So I would say the number one thing is listen to your body. If you know something's not right, you need to go get it checked out and figure out a way to make it right. Even if it's as simple as getting more sleep or eating right or getting some exercise or doing something for yourself. But for sure, see a doctor on a regular basis so that you're not ignoring anything that could go on to be more serious and harder to treat when it's been delayed.
Yeah, that makes a ton of sense. Okay, last question, and I want to dive deep into your specialty since you are an expert in breast cancer, or rather the detection of breast cancer. We see a lot in the media, and I know we've all probably read a lot about reducing breast cancer, detecting it early, prevention. What works, what doesn't, and what are your pearls of wisdom there?
So the number one thing I can say is get a screening mammogram starting at age 40. So it has been shown that getting screening mammograms starting at age 40 can reduce breast cancer mortality or death by 40%, which is a lot.
Yeah.
And that women that find their breast cancers by a mammogram, as opposed to feeling a lump, typically have much easier treatment. They sometimes don't have to have the whole breast removed. They sometimes don't have to have chemotherapy. It's so much easier to treat a breast cancer when we can find it early. And mostly we find it early when you come in for just a screening routine mammogram. It's so easy. It's mildly uncomfortable. There's very minimal radiation, and it's critically important. So everybody has a risk of getting breast cancer just by being a woman. There are some risks that you can't change and some that you can. So for example, if you're a woman, you can't change that. You can't change your family history. You can't change the age you got your period or the age you go through menopause. Those are also risk factors. You can't change the density of your breast, which is also a risk factor. But there are things you can change, and they're very much related to the things we were talking about earlier. So obesity is related to breast cancer, so you can keep your weight in control, decrease the alcohol you drink, for sure quit smoking, all the things we know that keep us healthy in general. Talk to your doctor about taking hormones. We prefer that you not be on hormones if you don't need to be. So there are a lot of things you can do to reduce your risk. And they mostly have to do with, in general, taking care of yourself and your health, especially by getting a mammogram starting at age 40. That's the most important thing. I can't stress that enough.
Mm-hmm. That is really, really helpful. Who knew that breast cancer prevention went hand in hand with overall wellness?
Yeah,
Obviously
absolutely.
you did, but Yeah, I like those are easy and things that are good for everybody to do.
And if you get a diagnosis or you get sick, for sure, those wellness things are so important in your body's healing. And there's so much mind over matter. And we see this all the time. Women that have ways to relieve their stress and just positive attitudes and positive thinking and things that they can do, whether it doesn't have to be meditation or yoga or anything fancy. It can just be, having positive thoughts or having a friend to talk to. All of those things can help you fight a disease, especially even breast cancer. Like, you'd be surprised how much easier the treatments are when you have some kind of release from the stress.
Wow. Yeah, that makes a ton of sense. Well, Dr. Bayless, thank you so much for your time. Thank you for being part of our community, and thank you for all that you do for us.
You're welcome. Thanks so much.